On this episode of Putting Possibility into Practice, we're talking 25 years of growth at Treasure Coast Community Health in Florida. What has led to the transformation of their practice over the years? And looking ahead, what's in store for the next 25 years? We're growing your practice through the use of Greenway Intergy. It's on this episode of Putting Possibility into Practice, and it starts right now.
I'm Joe Augustinelli, Social Media Manager at Greenway Health, and on this episode of Putting Possibility into Practice, I am joined once again by Sherry Cuba, who has been on our podcast before from Treasure Coast Community Health, celebrating a pretty big anniversary this year, and they continue to not only grow their practice, but be innovative in their technologies that they offer to their patients and an expansion of their community involvement. We'll touch on all of that on this episode of Putting Possibility into Practice. And so I welcome Sherry back to the podcast. Hi, Sherry, and thanks for joining me.
No problem. Always a pleasure, Joe.
And for those listeners who are not maybe familiar with Treasure Coast Community Health, and for those who have heard you on the podcast before but may not recall exactly what you guys do, how about a little background on Treasure Coast Community Health? How big are you guys? Where are you located? Number of patients that you guys see annually, and some of the services that your providers offer.
So Treasure Coast Community Health is located on the southeast side of Florida. We're in Indian River County, home to lots of fresh grapefruit and oranges. We currently are 5 medical locations, 2 with dental, and then we have 1 standalone dental. And excitingly, we are opening a new location in 2 weeks, so we'll be adding another one on there. We have 2 pharmacies on site as well, offering 340B, which many people know is a better price for pharmaceuticals for our patients. We offer primary care, so we have family practice, pediatrics. We have behavioral health, dental. We do diabetic eye exams with ophthalmology. Hard to say that word. An ophthalmologist technician who does the exams and then sends that off to be read. And we have health navigators, as we're a community health center. So we help patients navigate really the whole medical, dental landscape. And if they need assistance, help paying their bills when they come to see us, they see our health navigators. And last year we saw almost 20,000 unique patients. And nice to say that as of today, we've already surpassed last year's numbers, and we still have another month or 2 to go before the end of the year.
And we talk about the growth of a practice and the transformation of a practice, and it was interesting to hear throughout that you guys are continuing to expand. You've been in practice now for 25 years. This is celebrating the 25th anniversary this year, and continuing to grow the practice. When you when you add new services, new providers, how has that evolved over the past 25 years with the changing healthcare times?
Well, it's funny when you asked the question about it's our 25th anniversary, I had to go back and do a little historical dive. So if you'll forgive me for doing one little historical dive, I just wanted to say we started, of course, 25 years ago in 1993, and it was actually October of 1993 with a part-time doctor and a nurse. And we started out as serving farm workers, migrant and seasonal farm workers, which we still do. It's still at the core of our organization. So you can tell we started in the bottom of an old school that was here in Fellsmere, which is a farm working community. It got one light about 5 years ago, but until then it didn't even have a light in the town. And then 2 years later, we expanded into what is our home location in Fellsmere, and then started adding from there. And every time you bring on a new center, you learn something new. And with the addition of electronic health records and has made it a lot easier to do that transition, because everything you're following a pattern, and you've set that pattern up as you open each of your locations. And so by now, I think we feel like we're pros, and we've got this. We add in our new service location. We get everything set up. It's an easy transition. We're actually taking our chief medical officer is moving into the new location. And so it's really quite easy. We just follow her exact same schedule, but we change her template and take it from the one location to the other location. So it's not a huge inconvenience for anyone. It's easy to move our patients from one location to another. So technology has really helped as you expand.
And what advice would you give to a practice, who's going through expansion, or perhaps, looking to expand into additional locations as you have, keeping in mind that technology asset that you just mentioned?
So your big expenditures nowadays all come in technology. It used to be buying the beds for the location and everything else, although that still does put in a little dent in the pocketbook. But having your scanners at the front and your computers and all of those, the wiring in place, the things that you take for granted when you're already in an established location, you have to think about months ahead of time, which is, kind of different than before, where you would just put the power, go to the city hall or wherever it is you go, say, this is now my place, and you put it in your name. But nowadays you got to say, is it wired? Do we have to get it wired? And, that can take months. So planning for your infrastructure is now become like one of the biggest parts of opening a new office.
And throughout the past 25 years, you touched on the innovative technology and electronic health records, and how has Treasure Coast Community Health adapted to the digital trends in healthcare and utilizing the Greenway solutions that you guys do to meet the needs of a changing patient culture?
So, you just can't have an electronic health record anymore and be a silo. You have to be out there and working with other organizations. And so we've embraced early on. We like to think of ourselves as being innovative and doing things before it's a requirement. So we've participate in things like meaningful use. We do our patient portal for our patients, and we try to, anytime there's an upgrade or an update to something, we want to get it because we want to give the best information and out to our patients. And that includes chronic care management, doing text messaging for your patients for the portal, reminding them of their patients, their appointments, and other things like having a patient satisfaction survey go out to them, send a text out to them once they've visited you, thanks for coming, and sending out birthday messages, all those things that you can do using a patient portal that adds a little more familiarity to your patients. When you see over 20,000 unique patients, you've got to use technology as a way for them to remember you and for them to know that you know their name and know who they are.
And you mentioned it a little earlier, but just talk about the technology and the connection from, because you guys are a multi-location, facility. Just talk about the technology from one location to another and working collaboratively with each location of patients that are seen by providers in a number of different areas.
So the best thing that we did when we first set up our EHR system was we set us up as we are one location with different service centers. And we decided to do this instead of doing individual locations. So I guess the best way to think about this is we're all Treasure Coast, but then we might be in Fellsmere or we might be on our 9th Street in Vero Beach. But I can pull up and look at any patient that's been seen and see their chart, see everything about them, even though they may not have been seen by that location. And this provides great continuity of care for the patients, and it helps a lot. For instance, when we have new graduates coming out of school that come and start to work with us, they can be supervised by, I don't want to say a more seasoned physician who can look at the chart that provider is looking at at the same time they're seeing the patient and offer any advice or input that they need. So having that continuity of care is awesome for us. It allows us to use team-based medicine. We are accredited by AAAHC as primary centered medical home, and that allows us to provide for the family regardless of where they're seen at any of our locations.
And something I had seen is that you guys were recognized by HRSA, that's the Health Resources and Services Administration, as a 2018 Health Center Quality Leader, and only 3 other community health centers in the state of Florida received this recognition. So how important is it for you guys to receive that recognition?
It's huge. It's you always feel that you're doing the best you can do for your patients, quality-wise, but it's always great to be recognized by your peers and by HRSA, the Department of Health and Human Resources, to say that you are providing that you're not just providing it, but that you're improving every year. And the system helps us do that. We use practice analytics for our reporting, which provides us with robust reports that we can dig down into to see patient by patient, and that's what we do. If we have patients out of compliance in something, we run those reports, we pull it down to the patient, down to the doctor, and then when the doctors do their morning huddles, they have that information right there at their fingertips. So it helps them to focus on this patient needs an A1C. And it's not that it's forgotten, but it just puts it right there in the front that today I need to address this with this patient. So it's trying to use technology to help your providers provide the best care they can give for their patients, because they see a lot of patients, a lot of people coming in and out, and they're looking at today's problem. So using the reporting system kind of helps them focus on what might be needed that day.
And you talked about improving from year to year, so I guess that begs the question, celebrating 25 years, and I'm curious as to what's in store for the next 25 years for Treasure Coast Community Health.
Well, I would say some of the things that have happened and may happen sooner than later. We just started a virtual scribes program 2 weeks into it, so we're seeing how that goes. So your provider is in the room with the patient, and someone else is taking all of their notes to try to help them out, and they're not in the room. That telehealth is another big thing that we see coming down the pike. If value-based care comes along, well, we're, as you can see by our award from HRSA, we're already doing value-based care. So I feel like Treasure Coast is ready for the next 25 years, and we adapt well, and we're got a great management team that is always looking at what and how can technology help us best serve our patients.
Well, Sherry, I thank you for the time and the great information that you provided our listeners in regards to Treasure Coast Community Health. We congratulate you guys on everything you've accomplished in 2018 and throughout the past 25 years. And we're glad to be partnering with you guys and see the transformation of your practice. And we wish you and the providers continued success as we head into a new year.
Thank you. I appreciate that. And we're very excited to continue our collaboration with Greenway. Thank
you, Sherry. And for more information on Treasure Coast Community Health, I invite you to visit their website at www.tcchinc.org. You can find some great information on their website, the services, their locations. If you click on their news section, you can even see all of their great community involvement. And I think we might have to talk about the duck race that you guys.
The Duck Derby, yes.
The Duck Derby.
Yes.
We might have to have a podcast in 2019 dedicated to the Duck Derby, or maybe come down and get some live video footage of that. So that sounds like
that would be
time.
Awesome.
But again, congratulations to everything you guys have accomplished. And again, that website, www.tcchinc.org. Sherry DeCuba from Treasure Coast Community Health, my guest on this episode of Putting Possibility into Practice. And for more information on the products and services offered by Greenway Health, I invite you to visit our website at www.greenwayhealth.com. Thank you for listening to this episode of Putting Possibility into Practice. I'm Joe Augustinelli, the Social Media Manager at Greenway Health, and I invite you to subscribe to our podcast on your platform of choice. And now we're on a number of platforms, including Apple iTunes, Google Play, Stitcher, TuneIn Radio, Spotify, Libsyn, and SoundCloud. Thanks for listening.